Hi, I'm Kyle McCall, and I work with Integral Care on the expanded mobile crisis outreach team. And I also am a member of the Austin Young Chamber. And today we are going to be talking about mental health as a part of AYC's Wellness Week. And I'm going to cover three different facets of mental health. We're going to talk about general counseling services, and then we're going to talk about crisis services after that. And then we're going to discuss psychiatric medication as a final component and general wellness. I have Reno Gomez here with me, and he's going to talk a little bit more about counseling resources and general information about mental health.
Hi, my name is Reno. I'm a licensed clinical social worker, and I work in the program management position with Integral Care, and also I work in private practice. The general clients that I see or the people that I work with are young professionals and students who primarily, I would say, need some support to manage overall stress in their daily lives. So these individuals are really not individuals who are necessarily having some major psychiatric crises, but really just need a little bit of assistance with navigating the world during the pandemic, during times of high stress, during finals, midterms, or really starting off in a new career and trying to navigate relationships in that capacity as well.
What would you say to the general young adult, young professional population about some general information about mental health?
Well, I really like to work with individuals in terms of really kind of understanding their own personal window of tolerance and how everybody really differs in terms of how much stress they can really take in their lives, and how the idea of really working on coping skills, right? And I'm not talking about the easy stuff here. I'm talking about the things that are actually challenging yet good for us to actually complete in our lives, that really help widen our window of tolerance to get to a point where we can handle the stressors of daily life. I do think that we are in an inordinate time of our lives right now as a collective society, and I think people are being challenged in ways that we have never really been able to understand before. And in that sense, I do think that people such as myself, are in a position to really kind of look at what we do professionally and kind of alter what we do to be able to help more people, I would say. And an example of that really is being able to become more comfortable interacting the way you and I are interacting now. And I think that was one of the hugest learning curves within the field of therapy or of mental health service provision as well. And I think we've got a good handle of it now. So I do think that we're in a capacity that we can kind of get through those technological barriers and really try to get through the barrier of the computer screen. Because the fact is that we're really just trying to connect as humans, as individuals, to be able to share common human experiences as well. And I do think that a lot of people who have not engaged in therapeutic services before have a lot of maybe anxiety or questions, or maybe even fear of really just taking that first step. So I do think that the work that I do is really trying to alleviate some of that anxiety so that we feel as if we can hit the ground running and really start working on some of the issues that might be causing a person to really want to reach out to some extra support.
Thank you so much for that information. And what would you say to people who kind of don't know where to start? Where do I even look out for mental health resources? How would I find a therapist? Or if I just have some questions in general, what do I do?
Yeah, great question. So I do think that this is really kind of a case-by-case sort of situation. So some individuals might have insurance, either through their parents' insurance plans, or through their employers, or maybe even through the school that they attend. And I would definitely start there. If you have an insurance coverage, then I would look for calling the number on the back of your insurance card and seeing who a provider is in your area. I also think an online search of finding or looking for therapists that take your insurance would be a great start, because then you can kind of see people's profiles, what they like to work on, what their specialties are. maybe even what geographic area they're located in, if and when we get back to in-person services eventually, because most therapists are working and providing telehealth services right now. Other than that, I always recommend folks to really look at justmind.org for a comprehensive list of sliding scale resources, therapy agencies or counseling agencies in the community who might best be able to fit also kind of what the presenting issue is, right? There are a lot of agencies out there that maybe specialize in different areas of mental health. And so definitely starting there if finances are definitely a concern. And of course, Integral Care is that safety net in the community for individuals who are unable to really afford any sort of mental health services for themselves as well.
Great. So it sounds like there's a number of options that people can start off with. And after this, I think that it's important for us to consider, well, if we can't access mental health services, what would be the next step? And that would be crisis services, which I will be talking about in a second with Colleen. Thank you so much, Reno, for being here.
Yeah, thanks for having me.
And I have here with me today Colleen McCullough, and she will talk more about that.
Thank you so much, Kyle. So I work with Integral Care, and we do a lot of work at our agency to help people through crisis. A lot of people think that when you're in crisis, and a mental health crisis might look like somebody having thoughts of wanting to end their life, and or somebody they're not in reality, and there's something going on where you are not sure how to handle it, but someone needs to talk to them. Or maybe you yourself are unable to keep yourself safe, and you need that help immediately. That's what a mental health crisis might look like. And a lot of people think, I need to call 911, or there might not be an options, or maybe I have to go to just a psych hospital. But we actually have a hotline, a 24-hour hotline that is run by trained clinicians within our agency, and it's also through the National Suicide Hotline. We actually are the folks that, when you call the National Suicide Hotline, you're getting our hotline as well. But that number that you can access, it's 512 area code, and then 472-HELP, 472-4357. And what they would do is they would talk to you about what's going on, and they would recommend the best kind of care, including even sending out clinicians to your home or to your loved one's home to talk about what's going on and to get the kind of services they might need. And that's regardless of whether you have insurance or not. And of course, 911 is always available for you if that's something you think you need as well.
Great. And so what happens if you recognize someone else might need some help as well, and you're not sure what to do? You have a friend or family member or coworker, and it might be a little bit uncomfortable to talk to them about their mental health concerns. How would you think might be the best way to approach that conversation to get them connected?
Yeah, that's a really good question, and one that a lot of us deal with. As many or may not know, you cannot force somebody to get treatment, and it can be really hard to watch somebody that we love have an untreated mental illness that's really impacting their life. And all the time, go to a doctor, go see a doctor, or maybe a counselor, and they won't do it. Or perhaps they might, and they just don't know how to access it, or they're at the point where they don't even want to leave their home because of what's going on. So this would be a really good time to call that hotline, because what you can do is you can ask for a mobile crisis team to come out and see them, and the team would, they take the information. They even would try to maybe engage with the person in crisis, and then they would go out to try to see them and offer those services in person.
Great. Thank you so much, Colleen, for providing that information on how to access some crisis services. And, sometimes after crisis services, things might get a little bit more resolved, and we might need some additional support through medication. And so we'll be talking about that here in a minute. Thanks, Colleen.
Thank you.
All right, so now that we talked about counseling services and crisis services, and if those treatment methods are not working for you and you might need additional support, you might consider psychiatric medication. And here with me right now, I have Dr. Amanda McDonald, who will talk more about psychiatric medication and how it might be beneficial.
Well, thank you for that, Kyle. Again, my name is Dr. Amanda McDonald. I'm a doctorate prepared psychiatric mental health nurse practitioner. And as Kyle mentioned, so you have options. You start feeling a little bit of maybe a little bit of stress initially, some things that you can't quite handle on your own, and then you transition into perhaps needing a little bit of counseling. Maybe counseling works, maybe it doesn't work by itself. At that point, you can seek medication, and then maybe it transitions to a point where you hit some type of crisis or a trauma that triggers something that you can't handle. And those are points at which you can transition to medication. So over the course of the last year and into this year, we've had a lot of things going on in the United States, in the world, locally. It's just a lot to take in. So that said, stress levels are high, socio-political climate is a little bit rough, and that affects pretty much everybody. So whether a person has made it through relatively well or not, pretty much everyone has been touched. A lot of what I've seen is increases in anxiety, some acute stress, a little bit of PTSD, and then triggers. So some of what's happened has triggered PTSD responses from past traumas that people didn't quite realize were actually a problem until last year. So that said, there's medication that can help with all of that. Medication is never the only answer or like the cure to the problem. It's typically best in conjunction with therapy, counseling, processing what the problem actually is.
All right. Well, thank you so much for that information. Well, what would happen if someone does think, wow, all those criteria meet, and I really think I'd benefit from medication, but I'm not sure where to go to obtain this medication? What advice would you give people when they're looking for a provider or different resources that might be available to them?
So that's a really good question. It really depends on whether you're insured or uninsured. There's resources for both of those categories, no matter what. So if you are uninsured, you essentially can go to most places and still seek treatment due to legalities. And I mean, that's that. Another option when you're uninsured is Integral Care. Integral Care provides wonderful services, and there are a variety of services to choose from, include medication management and counseling services. And there can be other services added on depending on what types of care a person may need. In addition to that, insured personnel, they can also be seen at Integral Care. A different option that they have is to call their insurance or to go online to their insurance website, and they can search for the specific type of specialty they want. So psychiatry, counseling, therapy, specific counseling, whether it be family counseling or trauma counseling or EMDR, a specific modality, CBT, CPT. It can be anything that they're really looking for. They can just call the insurance and find it. And then even beyond that, there's different levels of care that they can go to. They can go inpatient, they can go outpatient, they can do partial inpatient, partial outpatient. They can, and then substance use. This is something I probably should have mentioned a bit earlier. Substance use has increased over the past year, and whether it be something that's causing a functional impairment or something that a person just believes is a problem in their life, you can refer to insurance, or you can also refer to Integral Care if uninsured, and they can give you a list of providers in your local area that will cover that service. And once you go see those providers, then you'll have a treatment plan and some type of idea of how long you would need to be in treatment. The goal in mental health is always recovery. That's it.
Well, great. Thank you so much for providing that information on psychiatric medication and all the different resources that are available to people. Thank you.
You're welcome.
All right, AYC, that's it. Thank you so much for listening to our presentation on those 3 aspects of mental health: counseling services, crisis services, and psychiatric medication. And I just wanted to take a minute to remind you, engage in self-care. This year has been really difficult for everyone, and it's impacted everyone more than some of us might realize. So there's lots of different resources you can engage online, classes you can take, and just time off that you deserve to just be able to reboot and refresh as we tackle a brand new year in the midst of more turbulent times that we are all addressing, in addition to our normal stressors of family life, work, and anything new that just comes our way. So again, thank you so much, and keep working on your mental health.